Hello all, thanks for joining today. We'll just wait a few moments while attendees filter into the room and we'll begin shortly.
Got a nice thumbs up there, Ben, and some hearts as well. Feeling the love already.
Appreciate all of the love from the attendees today. Great to see so many of you here today. Hello, Anatoly. All right, we have quite a few already. I think we could probably make a slow start, Steve.
Fabulous. Thank you, Ben. So just a quick introduction. I am Steve. I am the Communications and Marketing Manager here with the Alliance. Would absolutely love to welcome you to this briefing on the new World Hepatitis Day 2026 campaign brought to you by the World Hepatitis Alliance. Ben and I are going to be showing you through the campaign resources and giving you an outline of what the campaign is all about. This webinar has simultaneous interpretation from our wonderful interpreters who are also on the call and who I will try to speak slowly for. To listen to the original audio, please select original audio from the interpreter button that should be at the bottom of your screen, right there. Today's webinar, this is how it's looking with the agenda. We're going to quickly talk about World Hepatitis Day. We'll discuss some of the messaging and some of the new data that's informing that messaging. We'll then move on to the campaign resources, which I know a lot of people are very excited to get their hands on. We'll also have a Q&A session, just to mention at this juncture that Zoom has a Q&A function built into it. If you could submit questions via that would be really helpful, because questions entered in the chat box can get lost. So if you use the Q&A function, we'll be able to see those. We'll then move on to discussing how we can work together for the campaign. And then we'll have an overview of the timeline between now and the 28th of July. And then we'll finish up with final chance for questions and answers. So, Ben, do you think we're good to go ahead?
I think we are. You've covered everything very well there, Steve.
Fabulous, thank you. So, let's talk about World Hepatitis Day. Held on July 28th of each year, World Hepatitis Day unites the global community to demand action from decision makers to prioritize the elimination of viral hepatitis. As one of 11 global health days mandated by the World Health Organization, hepatitis deserves the visibility. The main problem globally is that we already have everything we need to eliminate hepatitis, and have done for a long time. We have fast and accurate tests, effective and affordable treatments, a proven vaccine for hepatitis B, and a 12-week cure for hepatitis C. Yet over 1 million people are still dying from this disease each year. So let's break it down. That's what we're doing on World Hepatitis Day. We're breaking it down for everyone, and that's why we chose this campaign name. The key messaging behind the campaign is simple. 287 million people are living with the world's deadliest communicable disease, and most don't even know. Low awareness, misinformation, myths, and stigma are stopping people from accessing hepatitis services and leading to a lack of action by decision makers. So, for World Hepatitis Day, let's break it down, get people the facts they need, and help eliminate hepatitis wherever you are. Now, in April, the World Health Organization published their Global Hepatitis Report 2026. And here are some of the key facts that it presents. Hepatitis kills more than 1.3 million people each year. This makes it the world's deadliest communicable disease. There are also nearly 2 million new cases of hepatitis B and C each year, almost a million of each. So it's not stopping. 47 million people are living with hepatitis C. 240 million people are living with hepatitis B. And since 2015, there's been a 17% increase in the number of people dying from hepatitis B. But even these aren't the whole picture. Our World Hepatitis Day campaign guidelines and PowerPoint decks, which we'll be showing you, highlight even more facts and statistics. And as people in the hepatitis space, you will all know there is so much to shout about. Hepatitis A, B, C, Delta, and E, who has access to vaccination and treatment, who is held back by stigma and discrimination, the repercussions and blockages across health systems. There's so much to discuss, and we urge you to bring your insight, experience, and expertise to the campaign because it's your campaign. As much as it is ours providing some resources, it's very much about what we can all bring to this campaign. So speaking of the resources that we've created, you can now find all of these at worldhepatitisday.org. The website has been refreshed. It has all of these resources, and we will be giving you a preview of that in a moment. You can find the following things there. We've got posters, and we have two kinds of posters, image-based and text-based. Before I go on with that, just to note that these are currently only available in English, but from next week, we will have translations in Arabic, Chinese, French, and Spanish as well. So the resources are split equally between image-based designs and text-based designs with relevant messaging, photos, and statistics. Here we have three. And here are three of the statistic-based designs. They're all in bold colors to grab people's attention and will look great in all kinds of locations. We have versions of this messaging and these designs across social media resources too. Half are in landscape format, which are ideal for LinkedIn and Facebook. The other half are square, and they come in groups of three. So those are 3 slides, and these make for great carousels that people can scroll through on social media channels. We also have customizable tools. If you want to build your own poster or social media graphic, these are on the World Hepatitis Day website, which Ben will guide you through in a moment. And for virtual meetings and presentations, we've created a PowerPoint deck on the left here with information about the global state of hepatitis and the campaign. And on the right, you'll see the Zoom backgrounds that Ben and I are also modeling right now, again in the campaign's bold color scheme. Between these, you can get people's attention in meetings and make the case for why we all need to break down stigma and care about hepatitis. So I'll hand over now to Ben, who will show you where you can find these resources, how to access them, how to make some of your own custom resources too.
Thank you very much, Steve. Are you seeing the website banner?
I sure am.
Fantastic. Hopefully you all are as well. So yes, many of you will already be familiar with the layout of the WHD website, but I think you'll all agree we've made it a little bit more streamlined, a little bit more spiffy for you all this year to make it a little bit easier to access some of the key resources that you're also familiar with. So here is our newly designed WHD website with the Let's Break It Down logo up front, our key messaging, key facts, and one of the assets from the year here on the homepage. And you can obviously scroll down, and this homepage will get embellished as the campaign goes on, where we add further details about some of the upcoming features, such as upcoming webinars that we put on the homepage here. But crucially, you will want to find the campaign resources, which can be found from the navigation menu at the very top. So here are the very campaign resources that Steve was talking about. As you can see, we have the language packs all available here. Well, they will be available as of next week, and you can download them all as a zip file. So at the moment, as Steve mentioned, only English is available. If you click on the image on the top sentence there, it will download the entire zip file to your desktop with all of the assets in there, everything from posters, socials, logos, carousel images for Instagram. It's all there. But if you would like to find the individual ones, you can also click here and you'll be redirected directly to the page which has each of the elements in there. And you can click and download PDF of the image posters, text posters. You can right click if you're on a desktop, or hold and hover over on a mobile phone to save all of the social images and the carousel slides, just like last year. So there's a lot of content on there for you to use, including some updated logos as well, based on what you would like to use for that campaign. But if we come back and scroll below those packs, you'll see some of the other resources that Steve mentioned. The full campaign guidelines can be downloaded as a PDF from here. PowerPoint slides, if you would like to take on the slide deck and create your own presentations, can be downloaded here. The logos, they're in country packages anyway, but if you want to get the full complement of logos and past campaign logos, you can find them there. And the Zoom backgrounds can be downloaded here. And crucially, here are our 4 tools for this year: the custom poster tools, the now infamous custom poster tools. You'll all be very familiar with the event flyer and how that works. Most of you will be familiar with the Instagram flyer and how that works, because it's variations on a theme based on how it's been with each successive year. Let's take a look at the A4 poster, which is modeled on this year's image poster. So for those of you who've never used it before, this is how it works. It's very straightforward. So it takes our core poster components, some of the core images we have and the core messages, and allows you to customize them into various languages. So it will use auto translate to update. Let's take Basque. Hopefully Basque works for this test. I haven't tested the Basque language out. We're about to find out. There we go. Translates into whatever language you want over here. And you can change the messaging from the drop down here as well. So we have the liver cancer messaging, vaccinate babies. That's not displaying correctly at the moment, so we'll get that fixed. And let's just go back to English for now, so we can work with something that makes sense to you. Vaccinate babies message and break the stigma message. It updates the poster, but crucially for you, you can add your own image to the background of the poster. You can upload your logo to sit beside the World Hepatitis Alliance logo and the World Hepatitis Day hashtag. And you can also change the entire text that's on the poster. So let's break the stigma. Hepatitis can affect anyone. Can just be changed to WHA, for example, and then you hit update poster, and it will update the top of the poster tool to whatever messaging you've got. And depending on how much you're writing or how little you're writing, the text box will expand or contract to allow for you to write as short or as long a message as you want. I won't go through the entire sections down here, but obviously you can see where these different text boxes relate to on the poster that you have here. So you can customize it with any image, any message you would like to. That's the A4 poster. You can do it on the Instagram image, where you can obviously change the background image. You can make it one of yourself, or you can make it one of your community activities. The event flyer can obviously be customized with all of the details of whatever event you are putting on for World Hepatitis Day, including locations, details of activities, dates, and the social images one is reflective of the social images that you saw in the English pack. Again, just being able to change some of the images that are used alongside it, uploading your own, and changing some of the key messaging that goes alongside it. So for those of you who aren't in one of those language packs that you saw at the top of campaign resources, fret not. If you're not one of those languages, you can customize the assets completely to your heart's content using the poster tool. And for those of you who are interested, you'll also be able to access some of last year's resources further down the page if you would like anything for posterity reasons, including some of our videos. And finally, Steve, I don't know if you were going to talk about this, but I'll just flag it for people. We have the take action page. Steve, I don't know if you want to talk any bit further about that.
Yeah, absolutely. Thanks, Ben. So we found that this page structure was really good from World Hepatitis Testing Week last year. So we've updated the World Hepatitis Day site to incorporate this as well. Um, People want to know how they can take action uh, on things like policy and campaigning and what they can do in their specialisms. So we've got three different audiences on this page. We've got individuals, and then healthcare professionals, and then policy and decision makers. Now, if we just go back up to the individuals. Thanks, Ben. There's a list of different things that we recommend that people try as part of the campaigning. But the key part of this is that you can take action by sending a campaign letter to engage in some advocacy with local, national, or even global decision makers. Ben, if you wouldn't mind just clicking on the view letter. This is a copy and paste version of the letter that you can make use of. But just below that, we also have a button where you can download a Word document that's branded with WHA and World Hepatitis Day, Let's Break It Down campaign messaging. Just below that, we have tailored actions for healthcare professionals. We have some publications that are just in process of being designed at the moment. Those will be added to this page, and we will send out communications about that. So keep an eye out on your emails and WHA social channels for updates on this, because these are going to be extremely useful resources to help you prioritize hepatitis in your work as a healthcare professional. And then similarly, if you work in policy and decision making, again, we have some tailored things that we would suggest you do to help take action. And again, we will have documents available here. There's quite a bit of crossover between the policy and healthcare sector at the moment with the things that we're writing and getting designed. But yes, these will be made available and we'll let everybody know when they are. So, yeah, I think that's everything from the website at the moment, Ben.
Oh, yes. And we'll take some questions at the end if anyone has any, of course. Steve, I'll let you share your slide deck again.
Thank you very much. I will just bring that back up. Great. There we go. So as mentioned, translations will be available from next week. Here are a selection from last year's campaign, just so you can
Sorry,
get a
Steve, you
sense.
might need to just share your other screen. I think we're seeing the primary screen, if that's what you want to call it.
Apologies. 1 second. Is that displaying better?
There we go. Full screen.
Fabulous.
Thank you.
Sorry about that, folks. So yes, as mentioned, we'll have translations available from next week. These are some examples from last year's campaign, just so you get a sense. And yeah, we're always excited to show things in different languages. So yeah, and as mentioned, other relevant resources that will go live between now and 28th of July will be folded into our communications around the campaign, both publicly and also with you directly. So keep an eye out for those. And as seen on the website, the campaign guidelines are available to download. They give all of the information from this presentation and more to help you make the most of World Hepatitis Day 2026. So it's a good time now for fielding any questions that people may have. Again, if you would like to add your questions to Zoom's Q&A function, that will allow us to see them rather than potentially getting lost in the chat box.
And we don't have any at the moment. So if anyone would like to raise their hands, Gloria has raised her hand. She's taking me up on the offer right away.
Hi, Gloria.
So if anyone else has any questions, please do raise your hands also, and we'll unmute your mic and you'll get a chance to speak. So Gloria, please.
Thank you, Ben and Steve. Thank you for hosting this important meeting. It's my first time and I'm happy to be here. I'm looking forward to joining in this campaign, the World Hepatitis Day 2026. So I wanted to learn about domestic funding for viral hepatitis elimination. So during the WHS, we received the World Hepatitis Report 2026, and we're told that there's funding fatigue globally, and we will not be able to sustain donor-funded programs, and we're calling on government to take on the responsibility to domestically fund their own, to develop their own hepatitis elimination programs and fund them. So I wanted to see, is there a way we can get some success stories? We hear about the strides in Rwanda, in Egypt, and other countries that have been able to put on and drive hepatitis elimination programs that are reducing new incidents, increasing hepatitis B birth dose vaccine uptake, and reducing deaths, increasing access to treatment and stuff. Can we get some materials around this conversation so that we can use them to better advocate for domestic funding in our own local context here in Nigeria on World Hepatitis Day and beyond?
Can I just check?
Thank you. That's all from me.
Thank you, Gloria. Can I just check that people can hear me?
We can indeed.
Yes, great. Sorry, my microphone controls had just disappeared for a moment there. The campaign pack so far doesn't have specific case studies at that kind of level, but there are plenty of resources across the World Hepatitis Alliance website, which I'll be mentioning further on in this presentation. I think the main thing about this campaign is that it's supposed to be flexible, and everybody will be coming to it with their own local context, national contexts, and so on. So we need to give an identity to the overall movement. So the things that are being presented here are a way to grab attention for the specific things that you would want to work further to highlight. So we can definitely help as the Alliance with finding you the kind of resources that you would need. We would encourage you to take a look at the broader World Hepatitis Alliance.org website for further publications, updates on the specific areas that you're focusing on. And then if you want advice on how that can be packaged together as part of the campaign, we can definitely help with that too. But the resources that we have here and that are available to download are mainly just a way of grabbing attention for those things.
Thanks, Steve, and thanks, Gloria. Mukul, would you like to ask your question? I see you have your hand raised.
What do you suggest? Do you want, like, shall we go and put these posters at the grocery stores, at the gym, at the temple? What are the places would you suggest?
Absolutely, any and everywhere, I would suggest,
Yeah.
Mukul, is our message, Steve, right?
Yeah, absolutely. Every single one of those suggestions is valid and great. I'm going to be touching on some of the ways that you can make use of the resources in the next part of this presentation, but definitely please do spread them far and wide. The main thing is because they're so bold and colorful, the stats are so large and egregious for what they are. We need to make sure that people see this campaign wherever possible. Community
Like they're eye-catching, I would say. It would be like eye-catching, so that the attention comes as soon as they enter the room, that the attention goes there.
Exactly, yes, yes. And having this alternating color scheme as well, the blue and the fire orange, we're hoping that it has this effect of wherever they're used, there's this immediate eye-catching aspect to it, and then you start seeing that around, and it starts building this familiar visual for people to understand that the campaign is happening. And yes, campaigns really function well in community settings. So things like temple, local places like libraries, universities, clinics, if the clinics are happy to promote this as well, if they are happy to get involved with the campaign, not just as putting up a poster, but whether they would be happy to promote it if they are doing services already, such as hepatitis testing drives. This is a great way to frame their activities as well. But we'll touch on this again a little further into the presentation.
Thank you.
A pleasure.
Steve, perhaps one more question from Dr. Ashraf, and then we can move on. Dr. Ashraf, please. Dr. Ashraf, are you able to unmute yourself? Well, maybe we can come back to Dr. Ashraf.
Certainly. Or if Dr. Ashraf wants to type their question in the Q&A box as well, that's an option as well.
Good idea.
Fabulous. So yes, how can we work together? This is where we start applying the campaign resources. So the first option is online. A lot of stuff happening online across everything these days. And so on World Hepatitis Day, we have our World Hepatitis Day relay, which we abbreviate down to hashtag WHD relay. It's really simple to take part, and it helps ensure visibility across the world for the entire day. Step one is to create a video message, either yourself as an individual or as a group if you're part of an organization or a community group. Please do keep it to 30 seconds long at the most. People don't tend to watch very long videos online. So if you keep it short, it's more likely that people will watch it. Step two is to post it on social media at noon in your time zone on World Hepatitis Day. So at midday, 12 p.m., however you want to think of it. If you do that at your time zone and use the hashtag WHD relay in the caption, we'll be able to see it. And we will then share and repost your video across our social media channels to help take your message even further globally. So make a video message and post it at noon on World Hepatitis Day with the hashtag WHD relay. And then the only other step to that is to explore what people are talking about on the day. You can read through other hashtags such as hashtag World Hepatitis Day across any social media channel. See what people are saying, engage with them, repost content, share content, and please do continue sharing your own messages. You can use the social media resources that we've created for you to use, and please do just keep on spreading the word online. Another thing you can do online is host videos of Vox Pops. So as part of World Hepatitis Day, we've started encouraging people to find out what people on the street do and don't know about hepatitis and help them get the facts. Vox Pops are short videos that compile clips from interviews with members of the public, and they're a really engaging way to find out what people know about a subject. First, just gain consent from people by asking if they'd be happy to answer a few questions as part of World Hepatitis Day, and then investigate what they do and don't know about hepatitis. You can provide them with the facts and document their responses. And after you've collected your interviews, just edit together a short compilation video using the most interesting footage. It's easy enough to do this on your phone these days. And when you've created that video, just share it on social media with the hashtag World Hepatitis Day, which you can see in the bottom left-hand corner of the screen at the moment. This will be something that we'll be able to see, and we'll be able to repost it and share it far and wide as well. And this can be done anytime in the run-up to World Hepatitis Day, not just on the day itself. It's a really good way to get people talking about hepatitis and get people realizing that what they thought they knew may actually be a myth. And of course, for a lot of people, WhatsApp is a huge part of being connected via the internet, via Wi-Fi, 5G. You can make use of any of our social media resources to message your networks. Those group chats you're in with family members, perfect place to highlight the hepatitis emergency and to help break down stigma, which is holding back so much progress. And of course, virtual meetings and presentations are a great opportunity to spread the message of World Hepatitis Day. You can use our backgrounds in your meetings, like Ben and I are doing, and see what opportunities you can seize to make a short presentation about the global hepatitis emergency using our PowerPoint presentation, which is available on the website. And as we were just discussing, another thing you can do is go public. So our campaign posters can be used in so many places. You can ask to put them up in the streets and shops, but also hospitals, clinics, pharmacists, libraries, community centres, universities. These are all places where they could be put up, and I think people will be receptive to that too. And as mentioned, if any of these places are already running community services, then that's a great way to draw those things together. You can also create a hepatitis event that raises issues relevant to where you live. A community rally, testing drive, a fundraiser for local services or a local charity. Use the custom poster and flyer tools that Ben showed you on the WHD website, and use those to help advertise where and when your event is going to happen. And some of our supporters go really big, lighting up billboards, lighting up buildings and hiring whole billboards. If you want any advice on this kind of action, this scale of action, please do just email us. We are contact@worldhepatitisalliance.org. We would be glad to give you advice on how you can go about doing these really big set pieces as well. They're really attention grabbing. They often get a lot of local news coverage as well, which is something you can remember for everything that you're doing outside in your community. See whether local media will cover it as well. And in writing as well. As mentioned, we have these campaign letters, and with all the online visibility that World Hepatitis Day brings, it's the perfect time to contact key decision makers about the growing hepatitis emergency. As you'll have seen, you can use the template document on our Take Action page to email or send them a letter directly, asking them to make concrete changes to how hepatitis is prioritized. Please feel free to customize this letter with your own local context and indeed any specialist areas, knowledge and lived experience that you have around hepatitis. because your story is an extremely important tool for this kind of advocacy. So, aside from everyone's amazing campaigning, how do the coming weeks look? Each year, we organise webinars around World Hepatitis Day, and this is what we're currently exploring for July. These aren't confirmed yet, but we're looking at potentially a new global hepatitis data webinar based on the recent global hepatitis report, liver cancer as a webinar to explore that subject further. WHO always do a global hepatitis webinar. They haven't confirmed the date this year, but it's usually around World Hepatitis Day. And then we've also been considering a webinar on triple elimination. And each year we also do our World Hepatitis Day community forum through the World Hepatitis Alliance. This, I'm sure a lot of you will have attended this in the past, but it's one of our highlights of the year. It's an incredible opportunity for members of the Alliance and anyone else who's interested in learning about their experiences to come together and discuss lived experience of hepatitis and what we will need to do within our communities, what we feel that we should be focusing on to really address this global emergency. It's always emotional in a really lovely way and very inspiring. So highly recommend people take part. We're looking at doing that on Monday, the 27th of July. Again, to be confirmed, but definitely get that in your diary. And this is how things would look as a countdown timeline to the big day itself. Again, a lot of TBC, but we will be keeping you all informed. So do keep an eye on your emails and our social media channels, and then we'll be able to firm up those dates. So, final opportunity for answering any questions that people have.
I think we have Michael again.
Yes, one of the posters had a picture of in the campaign Africa continent. Was there a particular reason for that?
One of the graphics mentions a stat about hepatitis B birth dose vaccines in Africa. It's not one of the posters, but it is included as part of the overview of the global hepatitis emergency. So it adds context. It's talking about birth dose rates, and it points out that in Africa, it's I believe the stat is only 1 in 5 children
1 in 5. Oh my God.
receive in time. I should point out as well that there's all kinds of different images that we can use for different local contexts for posters and social media options as well.
Do you have a? I'm sorry, I'm not up to date with the hepatitis literature. Even though I worked on hepatitis C and hepatitis B for nearly 15 years in HIV,
There's
but
a lot.
currently, huh?
There's a lot of literature, yeah.
Yeah. So, but I did research on hepatitis C, mechanism of non-response to antiviral therapy, and mechanism of non-response to antiviral therapy, and also on the mechanism of moderate to severe cirrhosis in hepatitis C genotype 3 patients, unlike other genotypes, way back in 2006. But my question is that, the Africa, do you have stats for other continents like USA and all that? If that, I would like to learn that. If you can provide me, I would appreciate that.
Absolutely. So we have pulled stats from the latest global hepatitis report by the World Health Organization. It's the 2026 edition.
Oh.
The stats that we have used at the top level of the campaign are more of a global overview, but it does have breakdowns of regions and countries within that. So I would say that the first stop would be to have a look at that report. We are also in the process of creating a briefing for that report because it is a big report. So we will be producing a briefing of the global hepatitis report that will give you all the key things that you need to know as well. And that's something that we will communicate to everybody through our various channels once it's ready.
Thank you.
No
So
problem.
how can I access that stats? Go to WHA website?
If you go to the worldhepatitisday.org website, which you can see in the bottom left-hand corner of this screen, the address, it's under the Take Action section. So where we showed those 3 different audiences, if you have a look at the healthcare professionals section, it's linked to from there.
Okay. Thank you.
A pleasure. Thank you, Mukul. Any other questions, Ben?
Doesn't look like it, Steve. I think you may have covered everything satisfactorily.
Fantastic. Well, if there are any follow-up questions, please do contact us at the Alliance. It's just contact@worldhepatitisalliance.org. Thank you, Michael.
Thank you.
And I mean, I've just touched on this, but it's a great opportunity to discuss how the World Hepatitis Alliance website is full of all the resources you could possibly need to build your areas of knowledge and expertise around hepatitis and share these with audiences as part of World Hepatitis Day 2. We regularly publish new resources. Here's just a handful of some of our flagship publications, including liver cancer, hepatitis delta, stigma and discrimination, and one of our community briefings, this one on a hepatitis B functional cure. The community briefings help get communities the facts about what's happening in healthcare and policy and what you need to know. In just the past month, we launched our latest NoHep publication, Test, Treat, Eliminate, which is a practical guide for medical professionals to implement and improve test and treat approaches to hepatitis C. And we would also encourage all of you to take part in the Community Impact Program. It's our free online learning platform full of modules about every area of hepatitis with video seminars by experts, many of whom you will recognize. It's designed to strengthen your knowledge and skills and provides step-by-step guides on how to bring both the head and heart to your hepatitis advocacy. And you can make use of it for World Hepatitis Day too. It's a fantastic resource, but generally the World Hepatitis Alliance.org website has everything you need to get up to date on every area of hepatitis that you could want. So before we sign off, we just want to extend a special thank you to AbbVie, Gilead, and Mirum. The campaign you've seen here today and will see out in the world over the coming weeks has been made possible by their support of World Hepatitis Day 2026. So thank you everybody for taking part today and learning all about the campaign. Please do go take a look at worldhepatitisday.org. Email us at contact@worldhepatitisalliance.org. If you've got any further questions, start using that World Hepatitis Day hashtag as well. Make your video message ahead of time, get it looking great, and get it ready to post on the 28th of July for the hashtag WHD Relay. So much going on. We will be sending you so many updates as well, keeping you informed of everything coming up. So yeah, thank you everyone, and let's go break it down.
Thank you all. Bye-bye.